everybody, Dr. Vonderlinden here at Dynamic Foot and Ankle Center in Lorton, Virginia. Today I want to talk a little bit about diabetes and your feet. In our practice and in many podiatry practices, we see a lot of diabetics, and in particular how it relates to their feet. Unfortunately, this population of patients is vulnerable to having a lot of signs and symptoms of problems related to their feet. Hi, Melissa. So in our practice, we see a lot of diabetics, and we always are educating them on being aware of their feet, to check their feet every day to make sure there's no areas of redness, blistering, breaks in the skin. Also to shake out their shoes every day, to avoid walking barefooted. Also to avoid using heating pads or soaking their feet in hot water. One of the things that can happen is patients can lose their temperature sensation, can actually develop third-degree burns. So studies have found actually that you can prevent amputations up to 85% in the diabetic population with a good diabetic program. And that would start with, of course, seeing your podiatrist. A little bit of facts about diabetics. About 10% of our US population is affected with diabetes. This is going to be higher in some other populations, like in the Hispanic population. In the adult population, approximately 1 in 4 adults are affected by diabetes. That's 25% of adults. Also, I read a study that showed if you were to add up all the diabetics in the world, it would represent the 3rd largest country. Of diabetics, 25% of those patients will develop an ulcer. 65% of non-traumatic amputations occur from patients who have diabetes. So this is a topic that I care about because I am on staff at the nearby hospitals, and I get a lot of consults of patients who have diabetic foot infections. Unfortunately, a lot of the times by the time they're already at the hospital, these are patients who have numbness, they have calluses on their feet, they have ulcers on their feet, and what happens is they develop an infection, and then the infection spreads to the bone. And the most aggressive way to manage infection in the bone is to, unfortunately, have an amputation. So what happens in this population of patients, unfortunately, again, is that they lose one toe. That makes them at risk of losing more toes. So we want to really inspire, recommend, urge, encourage, all the above, implore our patients to really get on a diabetic foot program, meaning they know what their blood sugar's been doing, they get their hemoglobin A1C measurement every 3 months. That's a number to look at their blood sugar on average every 3 months. Also to see their podiatrist, depending how often they need to see, whether it's every 2 months, whether it's every 6 months, but really checking their feet every day. That's the biggest thing. And if they see something that doesn't seem right, that they call their podiatrist right away. So if you have any questions, certainly feel free to post your questions, or we're here to answer. I hope everyone's having a great Monday. Up in Virginia, we finally got a little bit of sunshine. It's been raining. All right.